Let's talk. There is a real chance you are taking a medication you have absolutely no business taking. And the big thing is that a doctor gave it to you, even though he was trying to help you. Now, this is not a story of a bad doctor and a good one. No, but this is something more common and very dangerous. Now, before this video is over, you're going to hear a story that will permanently change the way you walk into hospitals, clinics, and any doctor's office for the rest of your life. Let me tell you about James. James was a young, healthy man full of life, the kind of person who goes to gym, eats vegetables, and probably tell people who don't why they should have to embrace that. One night, he woke up in the night and wanted to use the restroom and felt dizzy. That changed everything. He had a little pound in his heart and he felt to himself, this is just nothing. Let me get back to sleep. But he woke up the next morning and the pain was still there. All right, so he freaked out, went to see his doctor, who told him that he should go and take an ECG test. Well, he did so, and then the doctor asked him, come to my office and see me. And then he went to the office, he shut the door, and he got probably the most devastating news of his life. You have a hole in your heart. It cannot be cured. We can only manage it. In one sentence, James went from being a healthy young man with a heartache to becoming someone facing a death sentence. James believed it absolutely and completely because who wouldn't? A doctor with a telescope around his neck with a serious face and an ECG printout in front of him looks at it, seeing an abnormal reading on red, looked at you and tell you that you have a life-threatening disease. Who would not believe that? But then that was the beginning of his journey. He could barely stand without feeling dizzy, and his energy dropped drastically. Taking the medication, he never understood why he was taking and never had to question. Let's pause right there. Now, trust your doctors, but there's a difference between trusting a doctor and trusting any doctor for any problem. The difference is exactly what this channel brings to you. Before I go further, I would like to have you subscribe to the channel. Why? Because we're going to be introducing to you insight that will help you navigate the healthcare systems effectively and, of course, without stress. Welcome back. Now, James was not that type who lie down and accept a life sentence. But something inside of him told him that I cannot die like this. I need a second opinion. So he decided to see a specialist. He was referred by a friend to see a neurologist. Now, a neurologist examined him, ordered an x-ray, but after the x-ray, something stopped James. We call it instinct. You can call it gut feeling, but everyone has it. He said to himself, I think I need a second opinion on the ECG. And so he went and undertook another ECG test from a different hospital, different machine, different technician. But the result came out the same, abnormal again. And I just sat there in the room and trying to figure out how this is going to be. Is this going to be my reality? Something changed. He asked a simple, life-changing question that most people never ask. And he said, can I see a doctor who specializes in treating heart conditions? Wow. And then he was introduced to see a cardiologist. So the cardiologist examined him and then in 2 minutes came to a conclusion that he was absolutely well. There was absolutely nothing wrong with his heart. James almost fell out of his chair. So he was like, no, this is not correct. He brought out the ECG's result and he placed it on top of the table and says, then you have to explain this. The doctor looked over the results and said to him, well, that is because you are slim. And by the time the machines are fixed, the gadgets are fixed on your body, this part of your left side is actually having less skin. Yeah, so it looked amplified, but it's absolutely normal. So just say, I'm not sure I'm okay. The doctor say, well, I've done all the checks and I think you're good. However, let's do one more thing. And they referred him to do an echo scan to concretize his conclusions. And then the echo scan was done and it came out fine, perfect. There was absolutely nothing wrong with him. All he had was a chest muscle pain. With a little medication, he was fine once again. In fact, just hearing the good news changed everything about his disposition. He was 60% well. But what really got everything messed up was the fact that he was seeing the wrong doctors, though good doctors, but the wrong doctors for his kind of ailment. The result that sent James into a spiral of fear, medication, and months of declining health was actually a perfect result. The machine was right, the data was right, but the interpretation by someone who wasn't trained to read those correctly in context changed the result completely. And if he had continued in those medications, those lines of medications, the doctor told him that he could have lost his life, or it could have worsened the condition of his heart because he actually never had a heart problem. In medicine, the right drug for the wrong patient is still the wrong drug. James was completely fine, no hole in the heart, no life sentence, just wrong doctor, just wrong doctor. I want that to sink, just wrong doctor. Not the fact that the doctors were not good. Absolutely, they were amazing. Let me begin with the first doctor who looked at the ECG and said that you have a hole in your heart. He was a gynecologist, a very, very professional one at that, but not a specialist for the heart. The second doctor who looked at him and also said he should go get an X-ray was a neurologist, a fantastic neurologist at that. Now, there was nothing wrong with the doctors, but the problem was that he was taking the right ailments to the wrong doctor. A doctor being good does not mean they are the right doctors for your problem type. Now, your GP, which is a general doctor, is trained to see everything at surface level. They are entry points and essential, but they are not your destination. Specialists spend years additionally to specify or to go deeper in a particular area. For instance, a cardiologist do not just know about hearts. They know hearts the same way Messi knows how to score goals. Okay, your GP knows about football, but the cardiologists have memorized every trick and style for making the most out of the football. That is the easiest way to understand it. So the mistake John was making, or James was making, was that he was assuming that because someone was a doctor, he was specialist. But that is not true. And that the fact that someone was specialist means that he knows everything about that ailment. Now, here are 5 things that James wished he had known before ever starting out. And I believe you want to know about them. The first is before sitting down in any counseling room, ask, what doctor am I seeing? Not are you a doctor, but what kind of doctor? All right, this is important. What is your specialization? That's the right question. Don't be embarrassed to ask, and you are not being rude. You are being aware. It's important that you know exactly the doctor that you are speaking or you're meeting. Second rule, match your symptoms to the right doctor. For chest pain, you need a cardiologist. For persistent dizzying and headaches and all of that, you need a neurologist. Have diabetes, then you should be talking to an endocrinologist. You must be able to match that. And if you don't know how to do so, you can easily go on Google first and just make some search and figure out what doctor treat this. And then you'll be able to find some tools that will help you. This is so important. Most hospitals don't have consultants, and some have one consultant who treats all kinds of ailments. Now, that is very bad for you, especially if your illness is not in the area of specialty or specialty of that particular doctor. See, every doctor is great, but in their own field. Every consultant is amazing, but in their own field. So don't bring a heart challenge to a doctor who do not deal with that, who deals with something else, let's say stomach pains and all of that. He might give you his own counsels, his own directions, and he might be wrong. Even reading simple results should actually go in a wrong direction because he's not actually deeply trained in that area of specialization. So number 3, a serious diagnosis, especially one requiring long-term medication, deserves a second look. So if you get a diagnosis that looks very critical, don't just take it. Go back and do a second test. And then you come back to the second question I raised, who needs to address this? So do not take any verdict as the last. No matter what it is, go back, sit with it, and then check for a second opinion. With a second opinion, then you can say, who do I need to speak with on this matter? All right. Number 4, ask for a deeper test. Yes. The cardiologist, for instance, in this case, did not just rely on the ECG, he ordered an echo scan. Why? That is a deeper level of diagnosis to check further and to be sure that this is actually what it is that he's seeing. Now, you get a test or scan done, you might need a deeper result, so a deeper look into it. So you can ask the simple question: is there any detailed test that can confirm this? Yeah, a good doctor will welcome that question. All right, and some persons will say it's too expensive. Well, sometimes you just need clarity, and if you don't have that, you actually could be treating on the wrong track. You could be treating something that is not even a problem in your body, and it could actually lead to worsened health conditions. So, what you want to do is to get the doctor to help you know exactly what is going on by going deeper. So, with a deeper result, a deeper test, you get a broader look into it. And with that, consultants in that field can easily help you navigate into what to do to resolve the challenge. Now, let's go to the fifth thing you need to understand: trust your instinct. Yes. Sometimes you get a result and something tells you, I'm not too sure of this. Don't say a doctor have said it, that is it. No, go back and recheck. I'm going to be sharing with you some very, very amazing stories of people who literally got their life saved with just having the right information. And I want you to stay tuned with this. Now, make sure that you understand that self advocacy is key and important. The health system is actually full of good people operating in different specific lanes. Your job as a patient is to make sure you're on the right lane, and being aware, inquisitive, and open to direction is what changes everything. And I want you to stay tuned as we'll be taking you on the next. If you have not subscribed, we want to encourage you to do so. And of course, if this make a lot of sense to you, there's somebody also you know who needs to watch this. Share this video with them. And perhaps they're just about to change their life. And the next story we're going to be sharing with directions on how to fix this is something that so many people are actually falling victims of. And we want to make sure that we help you. This is the Street Smart class for everyone who really love their health.